Hello everyone, this is Jenny and I am starting my sensory integration assessment series where we will be going over just sensory integration assessment, what you need to look at, and just more information about it. So the first thing I really wanted to emphasize is that when you do a sensory integration assessment, you really need to remember that there are two main patterns to consider, and you need to really assess both areas to determine what the pattern of dysfunction is within sensory integration. So the first area that needs to be assessed is really the sensory modulation of a child. So this means that you're looking at over responsiveness or under responsiveness to sensory input in the child. And that area, the over responsiveness or under responsiveness, really impacts arousal, self-regulation, and attention to task. So I have a couple pictures on the screen that show what you might be looking at for these kiddos that have a sensory modulation disorder. So these are the kiddos that don't like to play with shaving cream or don't like any tactile media. So we call those kiddos tactilely defensive. You might also have kiddos that are auditorily defensive or just defensive in any other sensory modality such as oral or smell. They're just the sensitive kids. And they are over responsive to sensory input. Now you have kiddos that are on the other side of that, which are under responsive to sensory input. And that piece really impacts a child's arousal and attention to task. So you might have a student that just looks like they're tired all the time, fatigued, just a low arousal kiddo. So they just tend to be under responsive to sensory input. And there are sort of two types for that. So you have kiddos that really don't try to seek any sort of sensory input, and this is what you get. You know, they just look tired. It's hard for them to attend because they're just really not at the right level of arousal to learn. And then you also have kiddos that might look like this. So those are the students that are also under responsive to sensory input, but their bodies know it and they like to seek a lot of sensory input. And that is to help themselves maintain that level of arousal that they need to learn and to attend to task. But they're the ones that are moving around a lot during class. They're the ones that are running around. The teacher is always saying they can't keep still. So that's those kiddos. So that's the sensory modulation area that you need to be looking at. The other area that we are looking at is sensory registration and discrimination. So this area is where a student has difficulty with registration and discrimination of sensory input, but it impacts their perception and motor control. So these are the kiddos where they have a difficult time with their fine motor skills. So they might have a poor grasp, they might have difficulty using scissors and just using school materials and building with Legos or just manipulating objects, fine motor objects, any objects in their environment. And this also is these kiddos that have a difficult time with copying from the board. So that's really impacting their ocular motor difficulties and their vestibular processing, where they're not able to coordinate their posture, coordinate their head, coordinate their eyes in order to copy well. In addition, it can impact just their general motor planning, so their ability to copy letters, where you have difficulty with visual perception and tactile perception, which causes difficulty with copying letters. And then in addition, these are your motor planning kiddos. So they might have motor planning difficulties with gross motor skills, or they might have motor planning difficulties with just whole body types of things, which ADLs are affected by. As well as just these are the kiddos that you see that have a difficult time with organization because they can't keep their materials together. They don't know how to motor plan and how to sequence and how to manipulate their materials in an organized way. So the sensory registration discrimination are really your motor planning kiddos and your kiddos that have bilateral integration deficits or posture and ocular motor deficits. So there's two huge differences with what you need to assess during sensory integration. And kiddos can have both difficulties, like they can have some sensory modulation difficulties as well as some sensory registration and discrimination difficulties. But it's important when you're doing an assessment that you really take a look at both of those areas and patterns so that you can really distinguish what sensory area is being impacted, what if it is tactile, proprioceptive, vestibular, or their visual system, and in what way. So I hope that was helpful, and we will continue with the series next weekend. I'm going to call this my sensory integration assessment weekends. So I hope that you tune in and we will continue to talk a little bit more about assessing. Thanks, everyone.